An overnight car chase that turned into an officer-involved shooting. In the midst of this live shot, those tow trucks just left, and we've been seeing crews cleaning up the road. So it shouldn't be much longer, Amanda, before they reopen the northbound lanes here of I-35. One of the things she does is she'll spray the mosquito spray on her hand, and then she'll rub it on her children to make sure they stay protected. You can see the back end sideswiped. They tell me they've noticed a slight drop in volunteers signing up to help since last month. San Marcos CISD will not release its plans until later tonight at its school board meeting, but I can tell you district officials plan to propose pushing back the start date. It's something we've already seen at school districts across Travis County, plus Round Rock ISD. San Marcos CISD officials say they don't plan to add more days to make up for the delayed start. Instead, they'll propose adding more minutes to each school day. How many? We'll learn those details tonight. They'll also discuss if they plan to start the first couple of weeks online. For now, the district did confirm they'll offer both in-classroom and virtual learning. Another part of the plan includes the expansion of the school's one-to-one program. This will ensure every student has an electronic device to work on, like a laptop or a tablet. And once they decide what in-classroom learning will look like, the district will offer masks to every student and staff member.
The preparation for something like this is a daunting task, but at the end of the day, as a district, what we do is put our staff and our students' safety as our top priority.
Meanwhile, at Round Rock ISD, tonight's virtual town hall is already at capacity. That shows the uncertainty for parents. District officials say their latest survey found parents are split, about half and half, between in-classroom and virtual learning.
This is unlike anything that public education has ever faced. This will continue to evolve. It will continue to change, and we'll make updates.
The Austin Convention Center is ready. It's ready to serve as a temporary COVID-19 hospital. This is only for area hospitals that get overwhelmed. But right now, that is not the case. Candy Rodriguez spoke with health leaders in Central Ohio because they transformed their convention center, and she wanted to get some perspective and learn why they believe this is the best option.
In Columbus, Ohio, a 1,000-bed makeshift hospital sits ready but empty inside that capital city's convention center. Jeff Klingler of the Central Ohio Hospital Council says it's been that way for the past 3 months.
Beds were in place, partitions were in place, emergency generators were brought in.
Many cities across the country have taken this step. Thankfully, it's not one many have had to use, including Columbus. Klingler believes convention centers are the best option. Yes, they all have open floor plans and exhibit halls that help maintain social distancing, but he says it's what's hidden from view that matters most.
You look at the back of your convention centers and there's nothing but loading docks, right? There's all that area that we never see as people who go to conventions. There's all that back area that, again, was just so key, and that we knew in terms of having patient flow and having EMS drop-offs and all that, that whole loading dock space really would work out.
While Klingler says at this point they have not had to use the center, he says it's important to stay ready.
You know, preparedness is key. It's what hospitals do, but I do think this is certainly a learning opportunity going forward.
Here at home, Austin public health officials do not believe the up to 1,500-bed makeshift COVID-19 hospital will be needed right away. Nicole McNeely is a working single mom of 3 kids on 3 different grade levels. She says when school closed the first time, it was close to impossible.
It hit me pretty hard. So I eventually had to fess up to their teachers. I'm like, look, I don't even have internet.
She says she just can't do it again. But what choice does she have? Austin ISD announced this week it will go 100% virtual for the first 3 weeks of school. McNeely worries if schools don't reopen classrooms long term, her children will suffer.
I'm afraid that they're going to get so far behind in their learning that once they do go back to school, they're going to have to repeat an entire year.
She says she understands teachers are not babysitters, but having her kids in school means she's able to work at a local restaurant.
You know, I couldn't afford after school care, so I made sure I was off work by 3 o'clock. I can pick them up. I took them on a bus, took them home.
In Austin, child care for McNeely would cost several $100s per child per month. That's thousands of dollars she does not have. She says for her, working from home isn't an option.
I see a lot of people who tend to have more privilege and opportunity getting mad at things they have nothing, they don't even know nothing about.
McNeely realizes there is a health risk for her kids, but financially, she says she has no choice.
Now you're making me feel bad and throwing these high numbers of child deaths at me that hasn't even happened. So, I have to take the risk.
Chatting with the mom of 3, it is clear she is stressed. She says she understands why the district is moving classes online, but she says she doesn't understand why they can't work out a plan for parents like her, who barely make ends meet. Back to you.
All right, Candy Rodriguez on that really difficult situation.